Our pharmacist colleagues are so precious in the whole chain of management of asthma because they have that monthly face-to-face.
You've got some inhalers in here.
Pharmacists can play a vital role in doing health checks for children, making sure that they're using their spacer correctly, and also asking simple questions such as how many blue inhalers have you gone through in the last few months? That's often a key indicator of asthma's poorly controlled.
It is really important to be able to see who's overusing, who's requiring medicine very frequently.
Some patients think that, you know what, they're going to bring in their prescription, we're going to take the medicines off the shelf and that's it, hand it out, walk out the pharmacy. But really is the counselling part, is how do they use their inhalers?
So pharmacists can play a wider role than just dispensing inhalers. They can support its appropriate use, give advice, so they play a much wider role.
We know that most asthma in childhood is actually triggered by viral infections. There are a whole host of viral infections that you may be in contact with over a winter period. The average child gets a viral infection about once every month to 6 weeks. The one that we know that we can actually modify and change the severity of is flu.
So we also like to recommend having the Fluence Tetra nasal spray vaccination done, targeted for 2 years of age up to 18 years of age.
But to qualify, you need to have a chronic respiratory illness. So if the diagnosis of asthma hasn't been secured, you might not actually be eligible. That's why we're asking people to really hone down and work on making the correct diagnosis of the condition in the first place.
I think currently, through no one's fault really, community pharmacists are undervalued in asthma management, particularly in children and young people. And I think we've seen through the work that we've done within the Healthy London Partnership, certainly within the audit work that we've done, the knowledge that community pharmacists can gather from patients around their asthma management, but also the knowledge they can impart to patients as well and reinforce a lot of the key messages around good asthma management. Community pharmacists do have access to training. Sometimes they don't have as great an access as other healthcare professionals such as practice nurses or GPs. And that's something that we've tried to address within Healthy London Partnership by commissioning online training specifically to support community pharmacists in good asthma management in children and young people. Medicines use review is relevant to children and young people because it's an opportunity for community pharmacists to really check the adherence that people have to taking their medicines. By adherence we mean how comfortable people are in taking their medication. Do they understand how and why they're taking it? One of the things to consider with asthma is that it can change, and as a result of it changing, you may need additional prescriptions or you may need additional advice. The changes can happen quite quickly, and community pharmacists are very accessible within communities where they can be easily accessible either over the counter or on the telephone at weekends for further advice. The key findings of the asthma management audit we ran last year across all pharmacies in the city were some of the findings were good. We found a high level of uptake of inhaler technique assessment within children and young people. We also seen a high level of uptake of spacer devices within children and young people. One of the concerns that we seen from the audit was the high use of emergency supply services for inhalers. 1 in 4 children and young people in the audit had made a request for an emergency inhaler in the last 12 months. That really indicates that the asthma is not well controlled. If someone needs to urgently seek an inhaler, that means that they're not on top of their asthma management, and that's something as a health economy we need to be reacting to.